My fellow Idahoans, we are in the middle of an unprecedented and dangerous time in our state's history. With every day that passes, we are breaking records for the number of COVID deaths, the number of overall hospitalizations, and the number of new cases in communities all across our state. 749 of our fellow Idahoans have died from this aggressive disease, leaving a hole in the hearts of those who love them. Thousands of our fellow Idahoans of all ages have been hospitalized, suffered immensely because of COVID. In fact, about 40% of hospitalizations have been among those in their 40s and 50s and younger. Our coronavirus response has been about protecting our at-risk loved ones from this highly contagious and damaging respiratory disease. Our pandemic response also has been about preserving and elevating healthcare capacity so that we can all have access to care whether we have COVID or not, as demonstrated in my chart. Our hospitals and other healthcare providers are telling us too many healthcare workers across Idaho are out sick with COVID and they are contracting it within the community. And doctors and nurses who are healthy are overworked and burned out. This is the biggest challenge facing healthcare right now, the availability of trained, healthy nurses and doctors to care for all patients, not just COVID patients. And our hospitals are telling us that traveling nurses are increasingly hard to find. Idaho's largest healthcare provider just announced they won't schedule certain elective surgeries and procedures until Christmas. Our healthcare facilities are facing the same situation. They will discontinue all but the most essential services within the next few weeks. This impacts all of us, whether we have COVID or not. Our healthcare facilities are always rebalancing and shifting resources as needed, but the stress on our healthcare system as a result of COVID spread in our communities is simply not sustainable. Alarmingly, our hospitals are telling us it is only a matter of weeks at the current rate of spread before they must start rationing care. This means they will have to turn away people from the ER, or they will be unable to provide the best care for patients with COVID, heart attacks, strokes, and other health issues. This is unacceptable, and more must be done. Today, I am signing an executive order mobilizing the Idaho National Guard to respond to this emergency and expand capacity within Idaho's medical and long-term care facilities. The National Guard is always ready to assist with the emergencies and natural disasters. They are heroes and an incredible resource in times of need. My executive order calls up 100 Guardsmen to increase critical access in healthcare statewide. Adjutant General Mike Garshak is here and will expand on how Guardsmen will assist. Folks, all along our pandemic response has been driven by science. The science tells us that transmission is happening in small group settings with our friends and loved ones, where we tend to let our guard down about physical distancing and masks. Taking the right action in public is incredibly important, but it's more important that we continue those practices in all areas of our lives. That means we all must limit social gatherings and practice physical distancing and wearing masks with anyone, anywhere who is not a member of our household. The science also tells us that transmission is not happening primarily in classroom, which continue to be safe places to work and learn, but during the ancillary gatherings around schools. Today, I'm also signing a statewide public health order rolling Idaho back to stage 2 of our Idaho Rebounds plan with some modifications. What does that mean? It means gatherings of more than 10 people, indoor or outdoor, are prohibited. This does not pertain to religious or political expression. It means at-risk Idahoans should self-isolate. It means all Idahoans are encouraged to telework whenever possible and feasible. It means masks continue to be required at long-term care facilities. It means bars, nightclubs, and restaurants continue to operate, but patrons must be seated other than to enter and exit. This does not mean Idaho's economy is on lockdown. Businesses and churches will remain open under the new statewide public health order. However, all individuals and businesses should continue following recommended protocols to minimize transmission, including wearing masks when around others not in your household. Those protocols are available at rebound.idaho.gov. I want to reiterate something I have said many times before. It is very important that our students remain in their classrooms for in-person instruction as much as possible. We put millions of dollars towards the safe reopening of schools. Schools are controlled environments, and they remain safe places to work and learn when protocols are followed. School buildings are not the place where most virus transmission is occurring. The school closures threaten the biggest capacity issue facing our healthcare system, the availability of healthy workers. If a healthy nurse or doctor has to stay home to facilitate on-time online learning for their children, then they can't care for the sick and get us through this crisis. Our kids need to remain in school for in-person instruction as much as possible. I also want to talk about masks. COVID-19 is a highly contagious respiratory disease that spreads by spraying droplets from your mouth onto others by talking, sneezing, or coughing. Masks not only prevent you from spraying droplets on others, but it prevents you from breathing in the droplets from others and catching the disease. It's that simple. It is a fact that has been supported by countless scientific studies. Half of Idaho's population is under a current local ordinance requiring masks, but we are seeing non-compliance with these local orders. Or people are wearing their masks in public, but then taking them off in social settings, such as parties and other gatherings with friends, where the virus is more likely to spread. Law enforcement has the ability to cite individuals for violating local ordinances, but law enforcement cannot be everywhere all the time. That is why I maintain that this comes down to personal responsibility. Please wear a mask when you're around another person who's not in your household. It will protect you and your loved ones. It will slow the COVID spread. It will keep people employed and protect our economy, and it will preserve healthcare access for all of us. What does this mean for Thanksgiving? It is best to celebrate with others in your household and avoid traveling, so you don't unknowingly spread virus to loved ones. You can still connect with one another, but please do so safely. There are a lot of good tips from public health on how to celebrate Thanksgiving safely. I know these are difficult times and difficult choices. I continue to have great confidence in the people of Idaho to do the right thing, to protect themselves and their loved ones during this challenging time of our history. I want to introduce our first guest. Amelia Cortez is a young mother. She contracted COVID-19 while 8 months pregnant and ended up in the ICU. I want to thank Amelia for sharing her very difficult experience with COVID. Amelia, welcome.
Hello, thank you for having me. Today I'm going to be sharing my personal experience with COVID. I was in ICU in May for 3 weeks. During that time I had my daughter, and when I first got sick with coronavirus, I thought that I was just pregnant, out of breath, but little did I know COVID was taking over my body, and my lungs were shutting down. I wrote something here, a quick little something that I would like to share with you guys. Especially for my age group, I feel like a lot of us young adults, we like to go out with our friends, we like to go out to dinner, and we tend to get careless, and I think we as young adults need to activate and wake up, because this thing, COVID, is real, and it's here to attack our lungs. Excuse me, I have to gather my breathing here. Whether or not we have a hard time accepting it or we fall behind the PPE, we need to activate and be more aware of that this virus kills. Coronavirus is real, and I personally know this because, like I said, through late May through early June, or July, excuse me, I was in the ICU, alone, and without my daughter, without my family. I was around nurses and doctors, and even though they were there by my side, I think everybody can agree that just having your loved ones around it's a way of healing. I checked into St. Luke's on a late night because I could not breathe. My body was shutting down and my lungs were failing, and I did not expect to be fighting for my life for the next 3 weeks. The next day I gave birth to my daughter, and I knew I had to be separated from her due to this pandemic, and inside I cried because I was too weak to cry on the outside. My OBGYN held my daughter, and I remember saying, "Is that my baby?" And I let out a tear. Instead, my daughter was removed from my room, but never from my sight. It was instantaneously that all St. Luke's fell in love with my daughter, Seven. A few days into my hospital stay, I fought for my daughter to be sent home to my mom. But little did I know, my daughter had already been sent home, and I had lost 3 days. Everything was a blur. Now 2 weeks have passed into my sedation, and I had no idea that I was being flipped over for 16 hours onto my body. And sometimes when I would come to out of my sedation, I would end up in different countries, like East Asia. I woke up in some states, California, Arizona. I even woke up in the basement of Albertsons. And just the deliria and the hallucinations that I was experiencing were horrid. I was in a different world. And people have this misconception that in the hospital we're just connected to a tank. No, I was connected to a machine on the wall that would breathe for me at 15 liters. And if anybody knows anything about tanks and oxygen, 15 liters is quite a lot. So just again to my peers, I really hope that you guys can really understand where I'm coming from and take this seriously, because I almost lost my life, and I am, as you can see, still dealing with the repercussions. I am not able to work, and I have to carry around an oxygen tank with me wherever I go. When I got out of the hospital, my mother had to bathe me. She had to dress me. She had to brush my hair, help me with my makeup. I could not walk 10 steps without feeling like I was going to collapse. And at night, it seems to get worse. I don't know why, but maybe it's because of the activity. But when you are laying in your bed at night and you feel like something is sitting on your chest and you don't know why, you go and you look at your cords to see if they're kinked or if anything is in your way, and it's not, it's your lungs that are damaged. So I don't want to see any of my loved ones or anybody else out there experience what I go through or what I went through and currently dealing with. I like to personally thank St. Luke's. I like to thank all my nurses. Rachel, I know you're listening. Thank you for removing my tube and for taking care of me. I like to thank my mother who was there by my side through everything, and my family. Lawrence Crow, I like to thank you for sticking by my side and understanding that I'm healing. And just everybody else that's having me here, and anybody who is listening to this, I hope that you can just really understand that this is serious, and we need to be more careful and take more precaution. Thank you.
Thank you, Amelia. I'm so sorry you had to go through that. And I hope this serves as a reminder to our young citizens about how important it is for them to be safe. Now I'd like to introduce Rachel Thain, the St. Luke's respiratory therapist who treated Amelia while she was in the ICU. Rachel, welcome.
Thank you, Governor Little. I appreciate that. And I want to say hello to Amelia. It's so nice to see you. I think about you all the time. And unfortunately, Amelia's case is not an individual one. It's not random. That is happening quite often with we're seeing an influx of young patients. Some of my sickest patients have been in their 20s and 30s. And though they may not die from COVID or COVID complications, they're experiencing symptoms months later. As she said, she was there in July. So respiratory distress can damage your lungs. You can be required to be on oxygen like she is. You can have cardiac issues. I just had a patient admitted who was in his 30s, very healthy patient, but now he has 25% pumping from his heart. So we're dealing with that right now. So that's what I'd like to say about the experience in the ICU is I hear from the community, well, I'm not old, I'm not sick. If I get COVID, it'll be a runny nose or I'll lose my sense of taste and smell, but that's not necessarily the case. And we're finding that our very sick patients are on life support machines for 2 to 3 weeks. That's damaging alone as it is. And these patients being in the ICU for this long, it's holding up ICU beds. They need that ICU bed. They have to be on that life support machine, but that means we don't have room for heart surgeries. We don't have room for other sick ailments that require ICU care and ICU life support. Not only are ICUs full, our floors are full. We experience calls daily from outlying facilities, Washington, Oregon, all over Idaho saying, please take our patients. We are at capacity. We don't have staff to take care of our patients. Well, that's where we are now too. And I get a lot of comments about, well, set up a tent and expand the hospital, put disaster ventilators in the tent. Well, frankly, we don't have the staff to run those tents. We have healthcare workers that are out sick with COVID. We have healthcare workers that are out sick with just the normal respiratory season. We're coming into cold and flu season. If we're down healthcare workers, nurses, doctors, respiratory therapists, there is no one to take these patients. These sick COVID patients are not plug them in, set them and forget them. They require acute critical care. They require titration of medications. They require tweaks on the life support machine. I can't put somebody in a tent and forget about them. So it's very important that we do our part as a community to reduce the spread of COVID right now. More COVID cases mean more COVID admissions, which means more COVID deaths. And as a healthcare provider, one death is one too many, but I know we can't prevent that. But we can do our part to reduce the spread. And one way we can do that is, Governor Little was saying, is wear our mask. It's easy. It's really easy to do. And wear it properly. You know, wear it over your nose and mouth. As he said, I wear my mask to protect you. That keeps my respiratory droplets behind my mask. But you also need to wear your mask to protect me and keep your respiratory droplets behind your mask. If we can do this, we can reduce the spread. Droplet masks are proven to work. Okay, this is science. And people tell me how they feel about masks. And unfortunately, feelings are not facts. The fact is, I have been a respiratory therapist for almost 18 years. Every time I enter a patient's room that has a contagious respiratory virus, I wear my droplet mask. When that patient leaves their room, they wear their droplet mask. That is what we have always done with rhinovirus, H1N1 swine flu, the flu, influenza A and B. This is not new science, people. This is just science, and it's the same with COVID. The difference is COVID is so contagious and so widespread that now we are asking the community to also do what we have been doing for my entire career, and every healthcare worker already does. So please, we'll wear our masks to protect you. Please wear your mask to protect us. You know, if we can't get this under control, we're going into our busiest season. As a respiratory therapist, flu season is my busiest season. So I need people to go out. I'm going to say this too, try and get your flu shot this year and just be more conscientious. Because if we get an influx of flu patients and an influx of COVID patients, we're going to run out of beds. All those news stories you see in the big cities, that's unfortunately could be Idaho, and I don't want to get there. So we don't make money off of COVID. I've heard that before. And unfortunately, actually, we're going to be starting to lose money at St. Luke's. As Governor Little mentioned, we are pausing elective surgeries until December 25th. And that's a good start. But however, emergent surgeries happen all the time. People's appendix ruptures in the middle of the night, they have to have surgery. We have to have beds for these people. We have, I don't even know how many COVID patients, I don't want to give numbers because I don't have the facts, but the other day we had 190 system-wide. And it's nerve-wracking to work in the downtown hospital because we're getting patients from all of the St. Luke's facilities, Wood River, Magic Valley, McCall, Nampa, Fruitland, Meridian, because they're all at capacity. And masks do work. We are not seeing an influx of Ada County patients, okay, where masks are being more readily worn. We are seeing an influx of patients from the outlying counties. So I know it doesn't seem like it seems like you're in a small town and it maybe isn't that big of a deal, but everybody, no matter how small your town is or where you live, we just need to do it. We're a community. We need to take care of each other. It's not just about me and it's not just about you, it's about us together. Okay, I want everything to open up too. You know, I'm a community member. I went to school in Caldwell. I went to Boise State. My son goes to College of Idaho. We are members of this community, okay? And I want to protect you and I want you to protect me. So coming up with Thanksgiving, it's tricky. I understand everybody wants to gather. Just as Governor Little was saying, staying within your household is going to be very effective. Not traveling is going to be very effective. I just don't want this to be out of control and have a huge influx of patients after Thanksgiving break. We want, as he said, it's important for our kids to be able to go to school. I want that to happen, but if we can't get COVID under control, then we're not going to get there. Okay, we're going to be rolling back phase after phase after phase. So please, I'm begging you as a healthcare provider, help us, help us take care of you. I've been taking care of COVID patients since March. I have not contracted COVID. I am not going to contract COVID in the hospital. We are very safe there with masks, hand washing, socially distancing. I'm going to contract COVID in the community, unfortunately. It doesn't matter what store I go into. It doesn't matter what establishment it is. There are people out there still not wearing their masks or wearing their masks improperly. And at this point, it's a sign of disrespect if you're not wearing your mask. We're doing everything we can to keep our hospital running and to have open beds for our community members, and our community members are basically disrespecting us by not wearing the mask. And I know that might sound harsh, but that's the reality of it, and just, I'm going to do my part. Please do your part. And once again, Amelia, so great to see you. Thank you so much. And unfortunately, her incident is not isolated. I don't want to see any more mothers lose time with their babies, not being able to bond. Experience the ICU psychosis that Amelia experienced is very real. You know, I wrote a paper on it in college. It's very fascinating, but it's very real. So there are some things worse than death sometimes. And the rehabilitation process can be very severe. And if you're in your 20s and you can't walk and you're muscle wasted and you're connected to oxygen and you can't work, think about those things. Think about those things. So everybody stay safe out there, take care of each other. You know, I'm here for you at St. Luke's. I hope I don't see you, but we're going to do our best, and please do the same. Thank you.
Thank you, Rachel. We appreciate you and your colleagues for helping us get through this crisis. Now, General Mike Garshak will speak about how the National Guard troops will help during this emergency. General Garshak.
Thank you, Governor. Good afternoon. I appreciate the opportunity to speak to you today and would like to begin by reminding you of something I said when Idaho first began addressing the COVID-19 pandemic. When the Idaho National Guard is called, it's your friends, your family, and your neighbors coming together to support our communities. We're all citizens of Idaho working toward the same goal. And although this ongoing crisis differs from past emergencies, such as floods and fires, our principles remain the same: to help our community by supporting local jurisdictions, city governments, and state agencies ensure public safety. Throughout this crisis, the Idaho Military Division has been in constant communication with the Governor's Office, allowing us to anticipate and effectively respond to requests for support. The Idaho National Guard, part of the Idaho Military Division, is prepared to provide a host of capabilities to include mobile testing support, facility decontamination, or COVID screening, in addition to our ongoing planning and logistics support. Examples of our support to Idaho's COVID response include warehouse and logistical operations at several food banks across Idaho, and as personal protective equipment has arrived in state from the national stockpile, we've helped to ensure those supplies reach the communities where they're needed. We've also provided facilities to the Idaho Department of Corrections, which were used to separate COVID-free inmates from their general population, allowing IDOC to create social distancing throughout their facilities. The Governor's executive order today means standing up an Idaho National Guard task force, a unit that is scalable in size and capability depending on the need, and ready to receive and respond to a variety of missions. And although the missions may vary, we see the immediate need in assisting our healthcare professionals at medical and long-term care facilities throughout the state. By focusing our personnel on missions such as decontaminating healthcare buildings, conducting COVID screening and/or COVID testing, Idaho National Guard personnel will free up healthcare providers, allowing them to focus on medical care. The Idaho National Guard stands ready as always to help ensure our communities have access to food, shelter, medical assistance, and other basic needs. No matter the mission, the Idaho National Guard is a resource capable of providing an effective and professional response. Thank you, Governor.
Thank you, General.
We appreciate our troops stepping up to help our citizens during this challenging time. Now, Dr. Christine Hahn will briefly review our 2-week metrics, our vaccine planning efforts, and the new medication available for treatment, and then we will take your questions. Dr. Hahn.
Thank you, Governor. I'd first like to review the metrics. So it'll be no surprise to any of you that things are not trending in the right direction, thus our concern today. The number of cases, as you can see in the upper graph, are continuing to rise, with over 1,000 cases reported on several days. In addition, the percent of tests that are being done that are positive for COVID are increasing and continue to increase. Next slide, please. We do have available ventilators and ICU beds right now in the state. However, as you've been hearing, that is not what we want to rely on as we work our way through this. We'd rather not have to use those ICU beds and ventilators nonetheless, it is good to know that we do have them in place. Also, right now, hospitals are reporting that they have enough PPE on hand so that they are able to protect their workers, like Rachel, from getting infected. Next. However, we continue to have way too many hospital admissions per day. We set a goal of fewer than 8 admissions per day, and as you can see, we are not near that at this point. Next slide. And also, we continue to have people in the ICU, again, far more than our goal of fewer than 25 per day. Of course, we'd like to see nobody in the ICU, but we are clearly far away from that. And I believe that's my last slide, but please forward it if there's anything else on there that I missed. Okay. There are 2 other things I wanted to talk about. One is that some hopeful news. One is you're aware that there is a vaccine for which very good news was announced by Pfizer, that they were seeing very good efficacy of that vaccine in protecting their folks that volunteered for the trials, protecting them from COVID. We have in Idaho convened a vaccine advisory committee, and you can go on the coronavirus.idaho.gov website and see a list of we are very proud of the broad group of stakeholders we have brought together from the medical, healthcare, social services, and other groups to all work together to try to help us move forward, understand who should get limited supplies of vaccine first. We will be following, of course, waiting for the FDA to first authorize this vaccine to be used. We'll also be looking towards CDC, which has a vaccine advisory committee that will help determine broadly who will be getting it first. We think it'll most likely be healthcare workers. And our job in Idaho will be working with our vaccine advisory committee how to get it out quickly and effectively to those healthcare workers that the advisory committee feels should be getting it first. So for example, persons that work in hospitals, person that work in clinics where they're seeing COVID patients, that type of thing. They've met twice already. It's been a really productive and wonderful conversations, and you can go to the coronavirus.idaho.gov site to see more about the committee and their work. And lastly, I just want to talk about the new medication that is now available for patients with COVID. This was just also authorized by the FDA, and the name is a mouthful. It's bamlanivimab. Bamlanivimab, very hard to say quickly, and I'm hoping they come up with a brand name soon. This monoclonal antibody has been shown to be effective for patients with more milder disease who are at risk for being in the hospital but are not in the hospital. So this is an exciting development because right now our therapeutics are really limited to those in the hospital. This medication must be given by IV, but we have already worked with hospitals throughout the state, and those are being shipped to those hospitals that have requested it. And should patients, as they develop COVID, their healthcare workers can now determine whether this medication might be useful to them. This is similar to the treatment that was given to President Trump as he became ill with COVID. And we are hopeful. But these measures are not enough. We know that the vaccine won't be here for a while. We're excited about it. It's hopefully going to be a very helpful tool for us, and we also are very happy to see a new therapy available. But this is not enough to stem the tide of the rising infections. And I join everyone else who's spoken today in urging you to please help others, wear a mask, stay apart from others, try to avoid large gatherings. We need everybody to do their part because we are seeing a rising number of cases, rising number of hospitalizations, and these therapies, while very promising, are not going to save us now from the rise in cases.
Thank you, Doctor.
Now we will take your questions. Joe Paris, KTVB.
Thanks, Governor. During this address and while Amelia was speaking, we had a nurse call into our newsroom and ask, at this point, why no mask mandate? As Rachel Thain from St. Luke's highlighted, it's not a debate that masks work scientifically. And I know it's been an issue with enforcement, but how long can you go on with personal responsibility? As Dr. Hahn highlighted, we're trending in the wrong direction.
Well, Joe, as I stated, half the state's under some sort of a mandate now. And in fact, even in other places where there are mandates, the lesson needs to be we need these masks worn all the time, not out where they might be seen by a law enforcement official. We are trying to get this curve under control. And we know where the problem is. We know that it's obviously mask covering, but it's in these social settings, and that's why we address this in this rollback to a modified stage 2 to reduce the spread, to reduce those transmissible moments. There's areas all over that have mask mandates, and frankly, I believe, and that's why we're here, we have to make a better case for people to not only wear them where they might be seen by somebody in law enforcement, but where they really believe about the efficacy of the mask and the need for the mask to protect themselves and their community. Audrey.
Hi, Governor. I also have a question from a nurse who's on the front lines caring for COVID patients at every shift. What happens to National Guard's workers who are already working in the healthcare system? Do they transfer and leave us high and dry? This nurse also wonders what is being done for the mental health of healthcare workers and their families who are being emotionally abused and belittled by those who still believe this isn't real, who are burning out with a feeling of helplessness as numbers rise.
Your question from the nurse was very salient to today. We know that there's people, and that's why I believe I and the state needs to make a better case. It's reprehensible that our healthcare workers are being abused for doing their job. General Garshak, do you want to address who's going to be in from the healthcare field?
Yes, thank you. Yeah, that's exactly right. We do have many doctors, nurses, and healthcare providers in the National Guard. That's not the primary source that we're going to make up the task force with, because as you noted, that wouldn't make sense to pull them out of their healthcare position that they're currently doing to do it for the Guard. What we're talking about is labor and manpower to help support and relieve the healthcare communities from doing some of the screening, the mobile testing site, additional logistics support, whatever missions come in from the health districts through the Idaho Office of Emergency Management, we will tailor our response package to meet that mission request.
Thanks, General.
Melissa, welcome to the Channel 4 studio.
Thank you, Governor. You keep mentioning that half of the state is under a mask mandate, but that also means that half of the state is not under a mask mandate. So as you're calling in the National Guard and as we're hearing from hospitals that we're just a few weeks away from rationing care, are you comfortable that this isn't too little too late?
Well, I don't think anybody anticipated the increase that we have today. That's why we're doing what we're doing. I don't believe it's too little too late. I believe it is a crisis situation. As Director Jepson and I talked about time and time again, we knew in the fall when people went inside that there was going to be an increase in number. We had done a lot of work to expand healthcare capacity, and frankly, that's one of the reasons we're bringing in the National Guard to pick up any pieces and parts we can do to help in the healthcare capacity and also in long-term care facilities, and to be there available when needed when we start to distribute the vaccine. We are aware of the numbers. We believe that, and of course, we should start seeing some of the benefits of what we did 2 weeks ago when we roll back to stage 3. But we can see it's not enough by the skyrocketing numbers and the healthcare capacity. Betsy.
Governor, our neighboring state of Utah I've heard has mobilized their National Guard as well and is using them in part for contact tracing. This is something that our health districts have said they are overwhelmed on and finding it very difficult to do. Might that be within the mission of the Guard in this current call-up?
It is.
Okay, and then second question. In your limiting of gatherings to just 10 people, how do businesses operate if they cannot have more than 10 people inside a facility, say a retail facility or a restaurant? How does that apply to businesses?
This does not apply to either one of those examples that you gave. And in fact, we know from the contact tracing that we're doing now that in schools, in businesses, particularly where people are wearing face coverings, keeping distancing, and they're only having brief contact, businesses in particular, there's only brief contact, that isn't the problem. It's the casual social gathering that, and I hear this, I talked to Governor Herbert this week and Lieutenant Governor Cox about this very issue. The problem, we know what the problem is, and that's why we addressed part of it 2 weeks ago, and we're addressing part of it now, and we're trying to inform the public about the incredible risk in these social settings, and in fact, in restaurants where they're doing the right thing and keeping people spaced out, there's not a lot of evidence, there's always a few, that's where the problem exists.
Say in a large retail establishment, if they're not under a mask mandate, if they're not enforcing or even recommending or supporting mask wearing, might that not still be a source of spread in our state at this point with the kind of community spread we have? Well,
we continue to reach out, and there's lots of guidance for the retail establishments, but my experience is that's getting better all the time. Probably not at the rate we want it to get better, but it's getting better all the time. But that's why it's imperative for me to make my case to the people of Idaho about how important this is.
Thank you.
Scott.
Governor, sir, I want to make sure I understand, modified stage 2 does not apply to businesses?
Under modified stage 2, all businesses will be open.
Then my question, sir, is you said you need to make a better case for the wearing of masks. What better case can you make? How would you do that? We've just listened to Amelia and her story, which was riveting. We know that people are dying from this. How do you make a better case, sir?
Well, I think Amelia and Rachel made a very compelling case. And frankly, I should have been doing a better job earlier getting the Amelias and the Rachels out in front of the people of Idaho, because what I've been pleading, and Director Jepson, no offense to Director Jepson, what we've been pleading every 2 weeks obviously hasn't been working as well as we'd like to see it. So that was part of the reason, and both of them were very credible and very sincere, and we're hopeful that that'll have a bigger impact. Hi, Don.
Hey, Governor. Don with Boise Dev here. I've had a couple questions about ski resorts. As you noticed, it snowed today. Folks don't have a lot to do that's outside. Those are outdoor activities. How will these orders affect gatherings at Idaho's ski and snow resorts?
Well, I'm familiar with some of the protocols that the ski resorts are putting in. Somebody announced that Bogus Basin, because of the teaser snow that we're having right now, is already starting to curtail the number of people there. They're outside. People skiing a lot of time are wearing masks, even before masks were a requirement. What they need to do is keep their capacity at a certain level, and then what they do outside. I know some of them have contingency plans about where you got to go back to your car to eat. That's where the exposure is going to be. It's not going to be on the hill, and it's not going to be on the chairlift if it's somebody you know.
So does that mean that the limit doesn't apply, or it isn't part of this?
Well,
I guess
they're a business. I haven't talked to every ski resort in the state, but the ones that I'm aware of, they're keenly aware of this. This is not good for their business model if there's spread there. So to my knowledge, all the ski resorts have got contingency plans. They're just like a restaurant. If you're at the lodge at any one of our wonderful Idaho ski resorts, they have to have the same spacing requirement you would in a restaurant.
Thank you.
Hi, Troy.
Hi, Governor. Thanks for being available today. You've been beating the drum of personal responsibility for quite a while. And given where a lot of this infection spread is happening, in small parties, at homes, dinners, friends over, etc., what do you see in the numbers that gives you any indication that personal responsibility is actually working? And what's going to make it start working now as opposed to August?
Well, Troy, when I get out, I see face coverings much more prevalent now than I did not too long ago. That's hopeful, but this is a problem from all over the United States. If you get the briefing I get from the White House about, and it's available in lots of places, about the level of red all over the United States, it's a problem everywhere, particularly in the areas of the country where the weather's getting colder and people are going inside. As I said, I just got to make a better case for people to do the right thing. I have to make the connection between doing those small sacrifices and preserving our healthcare capacity. We've been talking about it since March, but I obviously haven't been doing a good enough job. But I think Amelia and Rachel did a very credible job today, and I'm hopeful that compliance gets to be better.
Thank you, Governor.
Katie Clark. Katie.
Can you hear me now?
I hear you now, Katie.
Thank you. Life with Zoom, it's always interesting. I was wondering, what would it take for you, what conditions would exist for you to actually be willing to impose requirements on people to wear face coverings?
Well, Katie, I will again try and do a better job of explaining. Face coverings are only effective if they're used properly and for the right amount of time, for a long, anytime you're around someone. So with states with enormous mask mandates, areas of the state of Idaho with mask mandates, it's still not being effective. We're still not getting our point to the people of Idaho about how important it is to them that if one of their loved ones or themselves gets hurt, there's a possibility that they're going to go to a primary care facility or, heaven forbid, a hospital, and there's not going to be room for them. That problem has always existed, but the magnitude of it is much higher now, and that's why we're doing what we're doing at this point in time. Melissa Davlin, welcome home.
Hi, Governor. You mentioned speaking to Governor Herbert and Lieutenant Governor Cox in Utah. One of the things I know that they've done is use their emergency notification system so they can reach all Utahns on their cell phones. Is that something you've considered in trying to figure out how to reach Idahoans and get the message across?
Well, they might get tired of me, but we're looking at all options.
As a follow-up question, speaking of governors in other states, I know that there are much stricter restrictions going into place in Oregon and Washington, even though they have much lower rates of spread. And I know that at least Governor Inslee has been pretty frustrated, quite frankly, with the number of Idaho patients who have had to be transferred to Washington hospitals. Have you spoken to those governors about a regional response plan since all of these communities are so connected? And if not, why not?
I have talked to the governors, but it's interesting to note, if you look at the map, in fact, the incident rate in the eastern part of Oregon is higher than the incident rate is in the western part of Idaho. It's climate, it's attitudes, it's a lot of things. But it's interesting if you go from like the Tri-Cities south. That part of Oregon and Washington it doesn't have the exact same incidence as it does here, but we've always transferred a lot of the healthcare in the northern part of the state has utilized Spokane, just like part of the healthcare in the eastern part of Idaho has used the Salt Lake hospitals. That's just a fact of life, just like Montana and Wyoming use part of the Idaho hospital capacity.
Yeah, one last follow-up question. When those hospitals stop taking Idaho patients, when there's nowhere else to divert patients to, what's the next lever to pull? Or is that rationing care? Is that the next step?
Well, if all hospitals are full, that's exactly right. Dr. Hahn's metrics she put up there has crisis standard of care that's the urgency. The urgency is when that red line gets perforated by that blue population, then we have to do those things, and that's what we're trying to prevent. Betsy Russell.
Governor, one of the major directions that our neighbor of Utah has been taking is to significantly ramp up testing of asymptomatic people. In particular, they have launched weekly testing of college students who are on campus all across the state and have announced plans to move toward regular testing of people aged 35 and under in the workplace as a way to get at this community spread that so often is coming from people who aren't showing symptoms. Is Idaho considering any measures along those lines?
Chris, do you want to talk? Yes, and of course, one of the things happening in Idaho is a lot of the institutions are only going to Thanksgiving and then they're going to be out. But do you want to talk about what the testing's taken with asymptomatics, Dr. Hahn?
Yeah, thank you, Betsy. Absolutely, you're absolutely right. We you may notice if you look at our total testing numbers week by week, not only we really focus on the percent positivity because that tells us what the disease is doing, but you'll also notice we do have a lot more testing available than we did in the previous waves. There's been a lot of work, very hard work to increase testing capacity in Idaho, not only PCR testing with all the major universities now doing PCR high volume testing. Hospitals have ramped up their capacity, and we've used some of the federal funding to help hospitals and universities buy lab equipment. So we've been working very hard to ramp up that capacity. Our number one priority is always symptomatic patients, but underneath that all, we are talking and developing a strategy. Our testing task force is working on that now. A few members. It'll go out to the whole task force for review to look at a bigger strategy for how are we going to start testing asymptomatic people, that routine type of surveillance. The Binax Now test that you're aware has been being distributed not only to long-term care facilities, but also to the district health departments and out to healthcare providers, out to the jails, out to prisons. Those are also boosting our testing capacity, leaving us some breathing room to try to develop more routine testing of asymptomatics. And I absolutely agree with you. I think as universities and schools come back into session after the holidays, routine testing is really something we're going to try to promote and continue to implement further and further as we get our handle on our testing capacity.
And I do have another question for the governor, if I may. Governor, do you have any message for your fellow Idaho Republican politicians, including our lieutenant governor and members of the legislature, who have resisted calls for things like wearing masks, the very thing that you're calling on Idahoans so urgently today to do?
They are all independently elected, and they can do what they do, and I do what I do. Like I said, we have to make a case. We have to make a case for how critical it is, and we made two great cases here just a minute ago, and we have to make our case to not only them but everybody around them about how critical it is. So I will continue to make case. I had a call this morning with all the House and all the Senate, and we had 2 doctors on that call to make the case to them about how critical this is. I've got a question from Bill Spence at the Lewiston Morning Tribune about the 2021 session, somewhat germane to Betsy Russell's question. That's their call. The Idaho legislature has to come back in session at some point in time. I think legislative bodies, and including Congress, all over this country, with this high level of spread, are all going to have to access and be cognizant of what the risk is to them and what the risk is to whoever shows up at those sessions. Fortunately, we put significant resources in, as many of you know, to where people do have remote access to the legislature. They can remotely testify. Those are all going to be helpful, but it's going to be the body themselves that will make that determination.
Thank you, Governor.
Clark Corbin.
Hi, Governor. Thanks for continuing to hold these events and talk to Idahoans about the pandemic. I had a question about schools. You talked today about how important it is to have schools open for in-person learning. As you know, yesterday there was a very difficult school board meeting where the Boise School District announced it will be moving to full remote learning after Thanksgiving because it cannot sustain operations. And I've been talking with school officials during your press conference today, and they've been asking if, as you activate the National Guard, if there's anything that they could do to help with schools because of all the personnel in quarantine, because of all the issues that they've faced. It sounds like a number of other school districts are in a similar situation to Boise where they just don't have enough staff.
Well, we put, as you well know, and you've written about it, we put significant resources into our schools, but I am very empathetic to the administrators, to the trustees, to the classroom teachers, to everybody in our schools. But I will reiterate what I said in my prepared remarks about the fact that spread, if in some schools, in some school buildings, are vastly different from other schools, and that's why our back to school initiative that we did was to give all the resources we could available to schools about how best to address that. We're not taking anything off the table about what we're going to do, and there's nothing to preclude us from making resources available. But the best thing we can do if we want our kids back in school is do all those things that I just begged the people of Idaho to do to lower the spread to where we don't have the spread and the viral loading in the community.
But nothing specific with this new order with the National Guard. I mean, I'm hearing from school districts that they can't fill substitute absences. They have, classrooms being unfilled. They're having to combine classrooms and have principals and people step in. Is there anything new that could be on the way to help?
Well, I'll ask General Garshak to respond to it, but it's somewhat similar to the healthcare. The National Guard members that would be the most qualified are the ones that are already in a school somewhere. So I don't want to take it out of one school and put it into another. But Mike, do you want to talk about that?
Yes, thank you. We're anticipating what our missions might be as they come to us through the Idaho Office of Emergency Management, which is part of the military division, so we work hand in hand with them daily. But as I anticipate what missions we might receive and we're preparing to respond to, could be the disinfectant of the buildings. And as we get these missions, based on the capability of our task force, we'll have to prioritize those requests as they come in. And that priority will lean heavily on the health district to help us establish where we can best be used to protect the citizens of Idaho. If that happens to be in the schools, decontaminating them overnight in between classes, then that's something we're prepared to do. Thank you.
Thanks. Thank you, General. Keith Riddler, last question.
Governor, Betsy kind of asked the main part of this question already, but I just wanted to pick up on that a little bit. It seems like the masks have become pretty much a political issue at this point, and there's a sizable section of Idaho residents who aren't going to wear a mask no matter what, even though they see the stats about infections and deaths. Your thoughts about that, and do you have any luck, perhaps, or make any attempt to change their minds?
Yes, we are. Matter of fact, we've come to the profound conclusion that what we've been doing hasn't been working. And we're going to do more outreach, a bigger media presence, an awareness, a much higher level of awareness. There's no better communicator on this than the frontline healthcare workers or the patients, as we've had here this afternoon, talking about the critical need for everybody to make a little small sacrifice to collectively protect everybody. We know, as Dr. Hahn said, we know that there's going to be vaccine. There's, a 30, 60 day variability window on when it's going to be here. But we also know this time of year we are so sensitive. So we are going to do all we can to ramp up public information, outreach, awareness of all the people of Idaho so that we can protect that critical healthcare capacity that we talked about that. With that, thank you all very much, and I appreciate it, and help us get the message out.